In June last year, it's now April, I first noticed that the vision in my right eye had gone down a little bit. I was sent to the neuro-ophthalmologist at the local university hospital, and she sent me to an MRI. And it turned out in the MRI there was a tumor in the right orbital apex. I started to research the medical literature. I found some, not very many, but some surgeons around the world who had published on transnasal surgery, meaning getting the tumor from the orbit out through the nose instead of going through the skull.
When Dr. Griffiths and I did the first transnasal endoscopic image-guided orbital apex tumor surgery in the year 2001, already by that time neurosurgeons were using that same technology to do pituitary surgery.
The people that, according to my research, had done the most operations of this kind were Dr. Griffiths and Dr. Krause here in Los Angeles.
So when Sammy was evaluated for his progressive loss of vision in his right eye, his MRI was done, revealing this small tumor that was putting pressure on his optic nerve.
This tumor was millimeters from the carotid artery, thus it did lend that complexity, and it was very posterior or behind the orbital contents. Our recommendation was to approach this tumor through an air-filled cavity or a natural corridor, which is through the sinuses and through the nose, coming from the side of the tumor.
I was relieved, first of all, to find out that there are options to brain surgery, that there is this alternative type of approach to get to the tumor, to save vision in that eye without needing to cut the brain open.
Once you have that experience, by choosing a transnasal endoscopic approach, it really is a wider, more open, more expansive approach in terms of being able to get around the tumor and being able to get on the posterior surface of the tumor and being able to protect those vital structures that are adjacent.
The most exciting aspect of this procedure is that it is minimally invasive and maximally effective in achieving the major goal of decompressing the optic nerve. But in many instances, we could actually remove the tumor successfully through the nose.
After the surgery, the vision started to recover fairly fast. Already the first day, I noticed that the color vision in my affected eye had gotten better. I'm very glad I came here to LA to meet Dr. Griffiths and Dr. Krause, and they were really supportive throughout the whole process.
Sammy is so pleased that he followed his gut, and he's so pleased that Dr. Krause and I have worked together to achieve this outcome for him.